Hi, this is Belinda Jenkins. I'm doing my informative speech. I have an audience of 5, including my videographer and 2 dogs, actually.
That'll focus. There's focus.
Okay.
Okay.
So my presentation is on living with type 2 diabetes. Have you ever been told you are what you eat? When you're diagnosed with type 2 diabetes, that's exactly what happens. One day you're eating everything that you want to eat, and the next they're telling you no white on your plate, no sugar in your belly, and you have to basically change your entire life. That's exactly what happened to me 4 years ago whenever my sugar was 539 at the doctor's office and my A1C level was 15. Type 2 diabetes is different from type 1 diabetes in that type 2 diabetes is insulin resistancy. So your body makes insulin, but the insulin is not effective absorbing your food when you eat it and helping you break down the food to and process it through your liver. So your body, or your cells most specifically, can absorb the energy that happens during the process of breaking down proteins and carbohydrates in your body. This causes your A1C level to rise and your blood sugar to rise as well. You may think this may never could happen to you. However, it can. Over 50% of Americans are basically walking time bombs. They're walking around not knowing that every bite that they put into their mouth is leading them or directing them directly into type 2 diabetes. The most common symptoms of type 2 diabetes is excessive thirst, frequent urination, yeast infections, night sweats, and irregular bowel movements, and sudden weight loss or gain, and typically it's gain. These are all symptoms for a woman when going through menopause. So I had all of these symptoms the summer that I got diagnosed, but I assumed that I was just going through menopause because I was at the right age and the symptoms were basically the same. For diagnosing type 2 diabetes, it takes a physician. They check your A1C level first, and if it's elevated, being above 6, then they do blood glucose levels through a stick on your finger. They also draw blood and send it off. Then after they see that your sugar or glucose level is elevated, then they have you do a glucose monitoring test for 30 days to see how your sugar fluctuates. So basically, I went in to the doctor and surprise, you have type 2 diabetes. Diabetes, again, is a chronic metabolic disorder that causes your blood sugar to rise and your A1C level to fluctuate up and down. We went through the symptoms, but here are some additional symptoms. You have yeast infections, vision changes, changes in appetite. Things that once taste good didn't taste good anymore. The diagnosis, of course, we've reviewed, and your signs and symptoms are evaluated. And it's funny because I found out kind of backwards. They checked my glucose level and said it was 539, and then they said to me, "Oh, and by the way, have you had any bloating? Have you had a change of appetite? Have you had yeast infections? Have you had night sweats?" And then after I answered yes on all of those questions, then they informed me that I definitely did have type 2 diabetes. They did blood tests. They did the fasting blood test and the regular random blood sugar checks for a month. And after that, they put me on medication right away. But I still had to go through the 30-day blood sugar checks to make sure that the medication was bringing the blood sugar level down. What are the causes of type 2 diabetes? Again, you are what you eat. If you have excess abdominal fat, or you're genetically predisposed, you have a sedentary lifestyle, meaning you lay on the couch and eat potato chips all day. Or for women, if you have polycystic ovarian syndrome, it's also a genetic marker that in the future you would have type 2 diabetes. High blood pressure, pancreatic disease, age, stress, unhealthy eating, and some medications can cause you to have type 2 diabetes. How do we treat type 2 diabetes? Medications. Metformin is the #1 prescribed medication in the United States overall, and it's the #1 treatment for type 2 diabetes. You can also take weekly shots like Trulicity, Ozempic, and Jardiance, and that helps boost the metformin to give you a little extra edge and lower your A1C levels. The first major change you have to make is a dietary change. You also need to start exercising and healthy living, and you need to reduce your stress. All of those things sound so easy, but they're not. We also have just discovered in the last couple of years that type 2 diabetes is at epidemic levels. In some countries, more than 70% of their populations have type 2 diabetes. It's increasing all the way across the world, not just in the United States. Although the United States continues to rise daily. Studies predict that the type 2 diabetes will double in the next 10 years. This prediction is based on a search of Medline, the Cochrane database of systemic reviews, the citation list of relevant publications. Poor diet choices, obesity, stress, lack of physical exercise contributes to the increase in type 2 diabetic cases, as quoted by Wegas Semi in his article, Effect on Diet and Type 2 Diabetes Mellitus. So basically, we're headed towards an epidemic in America as well. We need to be practicing self-care and better quality of life as a preventive for type 2 diabetes as well. If we eat better, exercise, diet, reduce our stress, then we can have a better quality of life with type 2 diabetes. A daily diary is maintained for the first 3 months to show the changes in blood sugar levels and to inform your physician on whether or not you're making lifestyle changes and to help with your type 2 diabetes, as quoted by Chin L. Meliglo in his article published with the Worldwide Epidemiology of Type 2 Diabetes, presented by Nature.com. Type 2 diabetes is at epidemic levels in most countries. It would be very unusual for you not to know someone who is affected by the disease caused by insulin resistance. Healthcare visits, testing, medications, diet restrictions, and education can improve the health of those who suffer from this disease. Will type 2 diabetes affect your family or maybe even you? If so, it's good for you to educate about symptoms, risk factors, treatments, and solutions to help those affected to live normal, happy, healthy lives. For me, it was a lifestyle change, but I'm happy to say it was a positive lifestyle change. Thank you. I hope you enjoy my presentation.